Hi, I'm Dr. Chad Larson. Thank you for joining us on another episode of Keep It Real. Today I'm visiting my friends again at Pure Prescriptions. I'll visit Pure Prescriptions every now and again so we can talk about nutritional supplements. Supplements are a multi-billion-dollar industry, but there's a lot of confusion and misinformation about what supplements to take, what are good supplements, why are there so many different supplements. There's so many different multis, there's so many different immune support and support for gastrointestinal function. So I'm going to help to educate you on how to choose certain supplements, what the various ingredients mean, and really just demystify. That's kind of one of the points of the Keep It Real show, is just to demystify natural medicine, talk about science-based natural medicine, and talk about really where the research is at. So today, one point of confusion that I've heard many times is people look on their nutritional label and they really don't understand what they're looking at, and they see things like percent DV. What does that mean? People have heard of things like the RDA. What does that mean? Is there a difference between the RDA and the DV, or the daily value? And so today I just want to break that down for you a little bit, and then I'll show you some examples on some supplements, and I'll show you really what to look for. So there's the RDA, which is the recommended daily allowance, and then there's the daily value, which is usually shows up on a label as percent DV, or percent daily value. So the RDA, there's actually multiple RDAs. RDA is recommended daily allowance, and it really depends on a few things. It's separated by, there's one RDA for men, there's another RDA for kids, and there's a couple different RDAs for women, depending on if you're a pregnant woman or a non-pregnant woman. And so the RDA can vary depending on gender, age, and pregnancy. So there's multiple RDAs, and that just lets you know what's the amount that a healthy person should have of each of the RDA nutrients. Okay, so that's RDA. That's one thing. And then percent daily value is the amount of each nutrient that's listed on a label, like a food product or a nutritional supplement. And so that has to be listed in percent RDA. And there's only one RDA, and it's from ages 4 and older. There's not multiple daily values for nutritional supplements. The daily value percentage is just one value per nutrient, and it's based on an average 2,000 calorie diet. So on a 2,000 calorie diet, there's a certain amount of percentages of each nutrient that you're supposed to be getting, which is a little bit different from RDA, which is dependent upon your age, gender, or if you're pregnant or not. So for example, let's take calcium. Calcium is the easy daily value to discuss, because the suggested daily value on a 2,000 calorie diet is 1,000 milligrams of calcium. So if you look on your nutritional label on a nutritional supplement, like, let's look at a multi. Actually, so we have a multi like this, and on the back, you'll see the percent daily value over on the side. And so the percent daily value tells you that it tells you what percentage of that total amount per day that this product is giving you. So the example of the daily value for calcium is 1,000 milligrams. So if you look on a product like this, and it says 20% DV, 20% daily value of 1,000 milligrams would be 200 milligrams. So you're getting, from that product, that means that you're getting 200 milligrams toward the daily value of 1,000 milligrams. So you're getting 20% of that daily value. That's all it means. So RDA is different. That's not what shows up on your nutritional supplements or your food labels. What shows up on your food labels is percent daily value. So hopefully that kind of clears up, what the RDA is and how that's different from the percent DV. But here's the thing, is that those are general basic guidelines. They will help to sort of prevent major pathology by being, just having enough of a certain nutrient, just sufficient. There's deficiency, and then there's, sufficiency, and then there's insufficiency. Sometimes before a person is fully deficient, they could be insufficient. And so some of the RDA values are at such a level that they're really just barely keeping you healthy. So for for most people who have an active lifestyle, most people need a little bit more than what the typical RDA or percent daily value. Let me give you an example. In certain situations, from a prescriber standpoint, sometimes we have to give somebody way, way more than the daily value. For example, this I just pulled off the shelf, and this is a liquid vitamin B12. Vitamin B12 is a fairly surprisingly insufficient and in many people even deficient nutrient. Vitamin B12 is vital for lots of different processes in the body. And if it's insufficient, there could be multi-systemic symptoms. So in people who are deficient, we can't just give them a little bit, kind of stick to the RDA or the percent daily value. We have to go well above that to really bring them up to healthy levels. For example, check out the daily value on here. There's 1,000 micrograms of B12, and that provides over 16,000% daily value. And so you go, that seems ridiculous. Why is that there? So here's the thing, is that B12 in a liquid or in an oral supplement form is fairly poorly absorbed. In fact, vitamin B12 has to jump on a taxi cab in your stomach. The taxi cab is called intrinsic factor. Intrinsic factor travels with the B12 all the way down to the very end of the small intestine called the distal ileum. And then that's where it plugs in and gets absorbed. So a lot of things can happen to kick it off the taxi cab and make it so it's not absorbed. So in somebody who's deficient, we have to give them very high levels just to ensure that the body's going to absorb some of that B12. In some deficiency cases, we have to give them an intramuscular or an IM injection, or even sometimes we'll put it in a intravenous mode of injection so that we can get those levels up much, much faster. Liquid B12 like this is still quite absorbable, and you could resolve a person's vitamin B12 deficiency, but it could be a little bit faster sometimes with an IM injection. So that's an example of, if you look at the label and it's several thousand% higher than the daily value, it could be for those specific situations where a person is deficient and they need to take extra amounts. And in some cases, you might just see on a multi, you might see that even some of the daily value of just some basic nutrients are a couple hundred times the regular percent daily value. And when you see that, just remember that I said just the basic levels are sometimes not really the optimal levels. They're keeping you from maybe manifesting pathology from a nutrient deficiency, but they're not high enough to really maintain an active, healthy lifestyle. So don't be surprised on some multis if you see the percent daily value higher than 100%. So I thought I'd just mention one more thing about a really common nutrient called vitamin C. Everybody's probably taken vitamin C at some point, and you may see it in a couple different forms. You might see it as ascorbyl palmitate, like this. And then you might see your vitamin C on your nutrients as ascorbic acid. So what's up with that? So the thing about that is a couple things. Ascorbic acid is water soluble. It's kind of the classic form of vitamin C, very easily to be absorbed, and it's kind of the classic vitamin C that you'll see on most nutritional supplements. But sometimes you're going to see on the label, it'll say vitamin C, and it'll say ascorbyl palmitate. And in that case, it's probably being used for a couple different things. First of all, when it's ascorbyl palmitate, it's in a fat-soluble form of vitamin C. So there's certain tissues in the body that accept more a fat-soluble nutrient as opposed to a water-soluble nutrient. If I can think of an example, tissues like nervous tissue, brain tissue, is mostly fat-soluble type tissue, and so a fat-soluble antioxidant might be more appropriate in that case. Oftentimes, if you see ascorbyl palmitate as a source of vitamin C in a general supplement like a multi or a multi-ingredient supplement, it's probably there as a preservative. Because it's a fat-soluble form of vitamin C, it has the antioxidant power, but also has the shelf life to really help to maintain the freshness of that particular product. So sometimes it's used as a preservative. It's a good, healthy preservative. So when you see it on there, it's okay and it's fine and it's healthy. And sometimes you might see it as a fat-soluble form of vitamin C. So I hope you learned something today. Just wanted to give you a little information about reading nutritional labels. I'll be visiting my friends at Pure Prescriptions periodically to pull some supplements off the shelf. It's a multi-billion-dollar industry. Chances are either you or someone you know is taking nutritional supplements. And so I'll keep educating you on that. Feel free to send me any comments if you have questions about nutritional supplementation or anything else about health, and we'll talk about it on the show. Thanks for listening, and keep it real.